Good morning, good afternoon, good evening from whichever location you are watching this video. And in this video, I'll be covering the basic Danphe EMR, EHR open source hospital management system flow, right? So this is the chapter 1, right? And in this chapter 1, we have like 6 lessons, and this complete video is of 1 hour. And in this 1 hour, I'll be going through how does a basic hospital management system work, right? The basic flow of hospital management system. I'm flashing on the screen all the 6 chapters which I'm going to cover. There it is right away on the screen, you can see. Also, I'm flashing also on the screen right now the basic flow which I'm going to cover, right? So 1 hour of video, chapter 1, and we'll focus on how to use the Danphe HIMS EMR EHR open source software. Now, in our YouTube section out there, you will see a lot of videos, right? But all these videos we can categorize into 3 parts. One is for the end user who is sitting in the hospital, who wants to use the software, right? What is the flow of the software? For them, I have made some videos. Second one is for the IT people who are working in the hospital who want to install the software. For them, I have made certain videos. And the last one is for developers, right? This video is for end user. For end user who wants to understand the flow, for management who wants to look into the Danphe system, right? For them, this video is there. For IT personal people, the videos I'm putting down in the description section where I've explained how to install the software. Also, I'm putting the link, which the developers can go through to understand, how the structure of the code is, right? So that if you want to understand the code, you can go through the documents as well. Now, before I start, explaining the software, before I start with the basic flow, right? Here is a simple request, here is a request to everyone. As an evangelist, to record these videos, it takes a lot of effort. One is that we have to create the software, we have to install in the hospital, and second is we have to make this code also open source. Also, we have to make videos, so that you understand, what Danphe is, right? It takes little bit of effort out there. So as an evangelist, I would like to see that, is this video really helpful, right? If this video is really helpful, I would like to record another chapter 2, chapter 3, and chapter 4, right? So here it is. If I get 100 likes, just 100 likes, I think that's not a big deal, right? If I get just 100 likes on this video, I will release the next chapter 2 where I will go through more advanced flows of Danphe. And also very quickly, I want to also give you a super duper gift out there, right? If you go and if you tag me on my LinkedIn, this is my LinkedIn account out there, and also you can tag Danphe out there, right? If you go and share this video on your LinkedIn, and if you tag us, right, we will add you to a Telegram channel, wherein we release, whenever new releases come, whenever new patches are released, we actually announce on that channel, right? So if you go and share this video on your LinkedIn, right, and if you tag us, right, on these accounts which I'm flashing on the screen, I will add you to that Telegram channel, and you can get the new updates of Danphe. Because what happens is we keep going live in many hospitals, right? So as we keep going live in many hospitals, new features get added, and those features, we talk in our Telegram channel out there. So here I'm flashing on the screen chapter 1, right? I wish I get 100 likes so I can release chapter 2, chapter 3, chapter 10, chapter 100, right? But here it is chapter 1. In this chapter 1, we are covering 6 lessons out here. I would advise to everyone that when you're looking at this video, don't think about that you want to install Danphe or not. Think about that, how does a typical hospital management system looks like, right? So I would like to get feedbacks down below that how is your flow of your hospital, right? So in the YouTube comments, please go and put that, how is your flow of your hospital. But here it is, what I'm doing out here is, in the first lesson, I'm just dedicating to some keywords out here, which is very important. Because many people think that HIMS is EMR and EMR is EHR, right? And many people don't understand what is a provider, right? So lesson 1, I will just go through some theory out here, which will talk about EMR, EHR, HIMS, and provider, and so on. In lesson 2, I will talk about the importance of maintaining a clinical history. Many people think that when you talk about EMR means it is just hospital management system. It is inventory, payroll, right? People do maintain the patient data, but they don't maintain the history. If you're not maintaining the history, it is not an EMR. So lesson 2, I have talked about it. Lesson 3, I am also talking about, the demo link and GitHub page and so on. Lesson 4, I'm going to go and show you the flow diagram, and which will help you to do the gap analysis with your hospital and see that how does this software fit you, right? Lesson 5, I will run through the basic demo, right? Remember, the demo link is also given in the description section out here. I will run through the basic demo, right? the basic flow, and the lesson 5 and lesson 6 I'll be going through the flow and the demo, right? So that's what we are planning, right? So let us start with lesson 1, EMR, EHR, HIMS, provider, and what exactly is Danphe. Now, before we move ahead and we look into Danphe, right, let us try to understand the difference between three vocabularies: HIMS, EMR, and EHR. The full form of all of the three I'm flashing on the screen out there, right? So HIMS stands for the Hospital Information Management System, EMR stands for Electronic Medical Record, while EHR stands for Electronic Health Record. So if you look at a hospital, right, you can divide the work of the hospital or the activities of an hospital into two parts. One is the management of the hospital, the day-to-day operations of the hospital, like for example, inventory, billing, finance, accounting, pharmacy, right? These are like some day-to-day things, which we have to do in the hospital so that the hospital functions properly. We term this as the management of the hospital. The second one is, which is more related to the patient, the clinical information, the treatments what we give to the patient. For example, what medication the doctor has given to the patient. For instance, the lab information, if he does a blood test, what kind of lab informations we have, the x-ray information, the radiology informations, right? So there are two parts, to the hospital. One is the day-to-day operations of the hospital, which is the management of the hospital, and second one is the clinical part of the hospital, right? So when someone says that this is the software which can automate a hospital, and when he says that this is an HIMS, he means that software is, that software can go and manage the day-to-day operations of the hospital, the management of the hospital, like the inventory, payroll, billing, and attendance, and many other things. So if someone says this is an HIMS software, that means that it should have, it should be able to manage any kind of hospital day-to-day operations. And when someone says that this is a software which is an EMR, that means that it can record medical informations, it can record clinical informations, it can do scans, it can log scans. Scans means radiology, right? It can gather data around the lab test and so on. Then this is the medical information, right? So when someone says HIMS, that means that we are talking about day-to-day operation. When someone says EMR, that means we are talking about the clinical part of the clinical part of the patient. And when someone says HIMS EMR, that means that it is both of them. Now, before we move ahead and we try to understand EHR, I want to define a very important vocabulary called as the provider. So when it comes to healthcare industry, there is this word which is used very common, is a provider, right? So what is a provider? A provider is nothing but it can be an individual person or it can be an organization which provides medical services to the patient or to anyone. So whoever needs medical services, if someone is providing out there, he's termed as a provider. So he can be a doctor, he can be a nurse, he can be a small clinic, he can be a hospital, he can be a lab assistant, right? So that's the definition of the provider, right? Now, when we talk about electronic medical record, it means that this information, the information of the patient, is stored with a single provider. So when a patient comes to an hospital, right, and he records his information saying that what issues he has or whatever medication is given, right, it is only confined to that hospital. So it is termed as an EMR. Okay. Now, when you take that information and if you say, okay, I want to go and share this information with some other hospital, or if I want to go and share this information with some radiologist who is outside the hospital, then we are talking about EHR. In case of EHR, the information is shared across multiple provider, electronic health record. So when someone says, I am an EMR, that means that software has the capability to log information within the same provider, which can be a hospital, clinic, or a doctor, right? And when he says EHR, that means that software has the capability to share the information in a secured way, in an elegant way, in a proper way with other providers. Danphe is an HIMS plus an EMR plus an EHR. It is a complete system which can help you to automate your hospital. If you're thinking of all that thing, to make your hospital paperless, your hospital should be automated, right? Then the answer is Danphe, and it is open source. Just in case if somebody wants the link of the open source, it is right below in the YouTube description section. You can get all the source code from there, all the documentation from there, how to install and so on, right? So Danphe is an open source HIMS, EMR and EHR. So if you look at this Danphe thing, please note, if you want to install Danphe, down below I have put the videos as well, that how you can go ahead and install Danphe yourself, right? So you can see out here, this is the screen out here. So as I've said, if you look at Danphe, it has billing, HIMS, then you have inventory, HIMS, right? Then you have accounting, HIMS. So you can see all that billing, inventory, pharmacy, right? These all that HIMS is there. Also, you can see it has clinical, which is the EMR, electronic medical record, right? So clinical for the doctors. You can see there is a laboratory out here. There is radiology out here, right? And also remember that it has the capability to integrate with other system. It has the capability to also, the whole system is made using web API. So if somebody wants to go and extract data, and if if you want, you can go ahead and make a call in a secure way to our APIs and get the data. So also it is an EHR. It also has the feature, if you want to export the data to the external system in HL7 and so on, those features are also available. So Danphe is an open source EMR, HIMS and an EHR. Now remember that the word EMR, one important point I want to reiterate here, look at this acronym EMR, electronic medical record. So medical record means that, if you say that this software is an EMR, we should be able to see the past history of all the medications, all the activities, all the history we have done with the patient, right? That is very, very important. Okay. For example, you can see on the Danphe screen, for instance, you can see that I can see that all the drug details of the past, I can see all the lab details, and that also should be in a chronological order, right? For example, if I see at radiology scans, I can see that he did a scan on 21st of March, then he did a scan on 24th of March, right? And so on, right? So, when you say that this is EMR, you should also be able to see the past history of the patient. And remember, the patient should not be carrying that file along, and you shouldn't be attaching, those papers, at the back in the file. Then, the whole thing of the EMR is lost, right? So whenever you are evaluating any kind of software, for a hospital or for a medical domain or for a healthcare domain, make sure that it is an HIMS. Make sure that it has EMR. Make sure that it has EHR. And I'm very happy to say Danphe has all of them. So now let us go ahead and see the demo of Danphe out here. Let us see that how Danphe looks like. So you can see that I am on the demo application link out here. This demo application link, you can get it from our GitHub page. This GitHub page, we have put it in the comment section as well. We have put it in the description section as well. So if you go to the GitHub page out there, one of the links out here is for the demo link. So if you go to this demo link, you can put the admin and the password, and you can see the demo. And just in case, if you want to go and install this software locally, right? That also we have given out here. You can see installation for support, right? So if you're a support person, if you're not a developer, right, and you still want to go and look at Danphe, right, you can go out here and you can go through these two videos, installing Danphe in a desktop mode and then configuring Danphe inside a web server, right? Both of them step-by-step guidelines I've given, right? And at this moment, when I'm recording this session, the version is 3.2, which we have released, right? But it is very much possible that we can release more versions out here. So all setups, the database, the license files, everything is out here, right? Just follow this video out here. So just follow this installation guide for support and everything should be good. And in case you are a developer, right, we have given here step-by-step installation guide as well. I will be going and preparing a lot of developers videos out there later on to how to go and build the application and so on, how to go and run the application, the structure and so on, right? So do go and visit our GitHub page. It is there in the description section out there. It's also in the comment section, right? Right, so that's where you can get this software for. And just in case if you have any issues, right, you can put us an email on these two emails which I'm flashing on the screen, right? So one is my personal email out there, right? And the other one is the email of Questpond, right? More than happy to help you. Okay. So let us now go ahead and look into Danphe. But before we go into Danphe, before we go into this, right? How about going and seeing the basic flow? What is the basic flow of the hospital Let us try to understand that first. Now, before we move ahead and start with the basic flow, right, I want to stress the importance of the flow diagrams. The best way to understand Danphe is to go through the flow diagrams. See, what happens is every hospital is different. With our experience, whatever I had in Danphe, right, which is approximately, I must have been a part of approximately 50 to 60 hospitals we have launched till now, right? One of the major issues what happens is the mismatch of the requirement, and specifically the mismatch of the flows. If you look at hospitals and clinics, they definitely operate almost in the same way, but definitely there is some kind of improvisation or must be some kind of changes as well, right? So what you should do is that you should look at the Danphe's flow. On the GitHub, I am uploading all the diagrams, all the flow diagrams out there. So look at that flow, look at your hospital flow, and then you will understand what the gap is, right? So let us start with the basic flow 1, right? The basic flow of Danphe, right? The basic flow of almost all the hospitals, what exists today, right? They must be following at least this flow 50 to 60%, right? First, we'll go through the basic flow, and then we will look at more in-depth flows ahead. So guys, let me go ahead and draw this diagram myself. You can see I have a pen on my hand out here, and as I'm drawing this diagram, I will try to explain the whole basic flow, right? So what happens? The first thing what happens is when the patient either comes to the hospital, or if the patient is calling on the phone and he says that I want to come to the hospital, right? The first thing what we have to do is that we have to go and do the registration, right? So what I'm going to do is out here, I will just say that the first thing, what really happens is, remember it's a big diagram out here. So just in case if something goes here and there and my handwriting is not so good, and what I'll be doing is that I will be creating a proper diagram of this and putting on GitHub. Also the diagram link, I will give it down on the YouTube channel out there, on the description section, on the comment section, right? So whatever diagram you are, and why I prefer to draw the diagram, because I think, then I will go with the flow. Or else what happens if I put a diagram just like that, what will happen is it will look confusing, right? So first thing what happens is we have to register the patient out here, right? Now, so I'll just go and say, okay, so what we have to do is we have to go ahead and do the registration, right? I'll just put here the registration, right? Now, again, certain things out here, you are going to go and register the patient only once. Means, let us say if Shiv comes in with the XYZ phone number, right, on day 1, and let us say if Shiv comes back again with this details, right, you're not going to go and re-register the patient again, because remember it is an EMR. So the patient should be registered only once, and it's his diagnosis, his medications, his whatever, details, what you're doing, the notes, right, everything should be maintained as per his visit, isn't it? So one thing definitely, if this patient is getting registered, the first thing is we will be checking is that if he exists or not, right? So if he exists, right, if he does not exist, then only the registration happens, or else the registration does not happen. So this is one of the very important things, which is needed in case of the patient registration. Okay, that's one part. But now, in the left side, you can see I have put up a large white area, and I'll tell you why I put it out there. Now, what happens is, so the patient or the person can call you from a mobile. So he can call from a mobile, say, hello, my name is Shiv and I want to come to the hospital. Okay. So one is you have the patient out here, and the patient probably calls from the phone. Second, the patient can also go through a website. Remember, we have a website from where you can book an appointment. So he can also come from a website, or must be the patient can come from a mobile app, or must be from a queue counter or from a ticket. I've seen, for example, in case of India and Nepal, many time, what the people do is that they go ahead, they take a ticket and they put their name, right? So this, if the person is coming from these kind of sources, right, the first thing, what we do out here, these kind of sources, when they get registered with us, we term it as an appointment. So, right, so I'll just write here appointment. So when, these kind of sources means the sources is not in the hospital physically. Listen to me carefully. the source is not, the patient is not in the hospital physically at this moment. He's sitting on in his home, or must be he has sent an email, hey, I am coming. He has made a phone call, right? So for such kind of thing, what we do is that we do an appointment. So in case of appointment, what we do is that we just take the basic details. We just take the basic details, because my handwriting, I'm so sorry. Basic detail means the name of the patient, what time he will be coming, right? And at the time we don't know, what issue he has, we don't know whom he has to meet also, right? So this is just an appointment of the patient, right? Now definitely there is another thing, where the patient actually physically he is inside the hospital. So I'll just say in premise, physically he is inside the hospital, and frankly 99% of the patients actually start from here, right? So one is that the patients can actually call from online, the appointment happens, or the patient is inside the premise and he says, hey, like I'm here now and I want to see a doctor, right? So the first thing is, what you will do is that if the patient has come in premise, right, what you do is that you say, okay, does he has an appointment? Is there some kind of an appointment for him, right? So you'll first say, okay, does he have an appointment? So does he have an appointment, right? If the answer is yes, what we do is that we pull the details, from the appointment, the basic details from the appointment. If he says no, like this patient, he's in the premise but he does not have any appointment, right? Then what you have to do is that you have to go ahead and put the basic details, because we don't know, right? We don't know the basic details of the patient, right? So this is what happens, right? And then these basic details are sent over here, right? Okay, so it is sent over here, and here we check, okay, looking at the basic details, is the patient existing in the software or not? If the patient is not existing in the software, you will go ahead and you will say, you will create a new patient out here, a new registration out here, right? If the patient is existing in the software, right, then what you will do is that you will create something called as a visit. You will create something called as a visit, right? And also definitely after the registration happens, you will also create a visit. So remember, again, let me try to explain. If he has an appointment out here, you will pull the appointment details and you will try to make a visit, right? If he does not have the appointment details out here, then definitely the basic details, you will actually put up the basic details, right? And the first thing what happens is, you will check that if this patient is registered in our database. If he's registered in our database, then we will go ahead and we'll say, okay, this is today's visit out here. Remember, one patient can have multiple visits. We'll talk about this later on, right? So if he's not existing in the database, you will register him in your DB. If he's existing, you will create a visit, right? So one is, this is the appointment route, and another one is directly in the hospital, right? Wherever it is, at the end of the day, he gets registered and a visit gets created over there. Now, when this visit is created, right, remember, whatever terminologies I'm seeing out here, you will say, no, this is all registration, fine. I'm just trying to say that when you look at the Danphe screen out there, you will see a word called as visit. You will see a word called as appointment. So you need to just map, please understand, right? So must be will say, oh, like this looks like all registration, fine. I'm just trying to say that what terminologies Danphe has and how you can connect to it, right? So the visit is created. So in the visit, now what happens is you need more details. So in visit, what happens is, the difference between appointment and a visit is that here you put more details. Who is the doctor, right? Why is he visiting, right? And what is his, from which region he is coming, from which country he is coming. So you will actually put more details on the counter out there, right? Now, and definitely when this visit happens, right, you have to first pay the doctor basic fees, right? So over here, what happens is, you're going to go and say that he has to go ahead and pay the doctor appointment fees, right? Okay, and this is where you hit the billing, right? So basic fees will be paid. If the patient is revisiting, must be this fees will not be paid, right? Whatever, but he has to pay the fees. Once the fees is paid out here, he goes to the doctor, and the doctor starts the clinical activity. The doctor starts the clinical activity, right? He says, okay, so you have paid the fees out here, and he's sitting before you, he's sitting before the doctor, and the doctor says, okay, now let me examine you and let me see that what I can do for you. So now from the clinical is where the whole thing starts. Clinical is the place, from where the whole thing starts, right? So what happens? The doctor can do 4 or 5 things, from the clinical, right? What he can do from the clinical. I'll just go and draw this parallelly out here. So from the clinical, right, he can put down notes. He comes and says, okay, what happened to you, right? Oh, you have fever. Okay, you have this, right? He'll put down some notes. He will take some measurements, right? And so on. He will record the height, the weight, and, all of the patient, right? After that, what he will do is that he can also go and give him medications, right? So from here, there are a couple of things which comes out. He can go and he can give here medication saying that, okay, you have to take 2 pills, you have to take 3 pills, you have to go and do some yoga or something out there. He has to give some medications, right? He can also say go and do some lab test out here. He will say go and do a sugar test, go and do a blood test and so on. He can also go and say that, okay, go and do some kind of a radiology, this scan or a chest scan or x-ray scan, whatever, kind of scan. And also he can give some procedures out here. Procedures means therapeutic procedures or procedures, which are diagnostic procedures, saying that, okay, you have to put a bandage or something, right? And many other things. Let me know in your hospital if there is something else other than this 3-4 things what I've shown here. But with my best knowledge, whatever I have in the hospital, right, these are the 3-4 things what happens, right? Now, and each one of these flows now will be having another flows out here, right? So he gives the medication. Now the patient says, okay, I can see that I have to take 2 capsules and this. For that, he has to go to the pharmacy, right? So what he will do is that from here, he will head towards the pharmacy, right? This is where I will say, this is the pharmacy. And it's very much possible that the pharmacy will do his billing separately. Because if you go to the pharmacy, he will say, okay, here are my 1,500 rupees or 100,000 rupees, whatever, right? And he'll say, give me these medicines. And what he does is he collects the money and puts it in his kitty, right? Remember, when it comes to billing, what I find is that in hospital, one is there is a internal billing of the hospital, right? Where you go and you say, my lab test, my scan test and all that, right? Another one is when they outsource the pharmacy to a third party, right? Or they outsource certain sections to a third party, they have their own billing, right? Now it depends, some hospitals say, no, we have a centralized billing, then we will have a flow accordingly. And if you don't have a centralized billing, you will have a flow like this, right? But for now, I'm assuming that this medication are taken from a pharmacy and the pharmacy will do his own billing, right? Now, in case of a lab, what happens is, in case of a lab, in case of a radiology, in case of the procedures, he has to go and pay first in the billing department, right? So here, I'm just going to go and put a big billing out here, and this is the billing, right? So what happens here is the lab, whatever test has been said, he has to first go and pay the bill. The radiology, he has to go and pay the bill, and so this is all happens in the billing out here, right? And once the billing is done, then the execution happens. Means, okay, once you pay the bill, you can go to the lab and do the blood test. Once you pay the bill, you can go to the radiology and do the scan, right? So the execution actually happens out here. And after that, you get the results. I just put your results, right? Okay, so here we have the results, before us. Now, from all this, from by looking at these results, right? And this is a very important part. Please pay attention here. By looking at these results, by looking at these notes, the doctor can decide certain things out here. The doctor will say that, do we have to admit this patient or do we don't have to admit this patient, right? So if I say admit, right? So if the patient is not admitted, that means he's going to go out that day itself from the hospital. He will exit from the hospital, taking all the capsules, taking all the labs, right? He will just exit. And this is what we term it as an outpatient. I'm sure that if you are, and that's what we say OPD, right? It's an outpatient, a person who comes to the hospital that day and he exits the hospital the same day. But if he says, no, you have to get admitted, then you become an inpatient. So if this is yes and this is no, then you become an inpatient, and an inpatient has a different flow altogether. Remember, my handwriting is too bad out here. It's an inpatient, right? He becomes an inpatient. So these are the two important types of patients out here, inpatient and outpatient, right? So that's what the important flows are out there, right? And again, let me tell you, most important thing, in hospital at various places we hit finances. We exchange money, right? For example, if you see out here, here's where we hit the billing. One place we are hitting the billing here, the second place we are also doing some transaction here. All of this has to go into accounting. This is very, very important, right? So whatever you do out here, this will go and hit here, this will go and hit here. So whatever transaction happens has to go as a debit or a credit into the accounting at the end of the day, right? Now I do understand, there can be other things like attendance and so on, and HR, really, I don't want to go into that, right? But this is what I feel that a basic HIMS and an EMR should have, right? Appointment, okay, an appointment system out there, a basic registration, and make sure that you don't have duplicates, right? Visits, so if he comes today, tomorrow, day after tomorrow, right? He pays the money, he pays the doctor fees out there, right? The appointment fees out there. And then from the clinical, we should be able to record the lab. We should be able to record the results of the lab, the results of the radiology, right? Medications in the pharmacy, we should be able to do the bills. There should be easy way of putting the notes out here, right? And definitely, there should be a basic accounting at place. Definitely, many people have their own accounting, but internally in Danphe, we have a basic accounting. And if you say, oh no, like I want to go and connect to Tally, or I want to go and connect to some other software, that is okay, right? But there should be a basic way of recording the journals and vouchers so that you can connect to accounting, right? So this is what I feel is the basic flow. Now what I want is, this is the most important part. Look at this flow. This flow also I am putting here as a diagram in GitHub. Take this flow, and after this flow, I'm going to go and now start showing you demo of each one of these flows. I'm going to go and start showing you appointment flow. I'll be showing you registration flow. I'll be showing you visit flow, right? And see that, okay, so my hospital works like this, or I want to work like this, and this flow matches with me or not. If that flow matches with you, right, or if there is a gap, right, that will help you to understand that is Danphe, how much percentage is Danphe suitable for your hospital. So let us go ahead and get started now with each one of the demos. Now guys, what I'll do is that I'm going to go and close off this video out here. I will not be showing my face, and I will just be focusing on the software, right, on the URL, and we'll go and see the basic flow. My whole goal is to go and show you the basic flow. So let us switch off this camera and let us start with the basic flow. So now let's start with the demos, right? So before we start with the demos, right, let's name this whole flow as basic flow. This is the basic hospital flow, which is almost applicable to all hospitals, right? And now we'll go through each one of these flows, what we see out here, right? So let us first start with the appointment flow. I'm sorry, this name is this spelling mistake out here. I'll correct it. Appointment flow, right? So in case of appointment, I said the person calls up through the phone. The person can come to the website. He can come through an app. He can take up a token. But the thing is that in all of these three, right, he is not present in the hospital, right? That's when we say it's an appointment, right? So to do an appointment, right, and remember, while we do the appointment, we only take the basic details because we don't know, what the patient wants, who the patient is, what he has issues, right? So what maximum we can do is that we only know that his name must be his date of birth, right, male, female, right, and which doctor to attend, right? So there it is. So if you log in out here, so think about it. The whoever is the person who is sitting on the desk, he gets a call or he sees the mail that, okay, somebody wants an appointment. So he will go to the appointment screen out here and he will click on appointment here, right? Now when you click on appointment, we have something called as counters. Now what are counters? Counters are nothing but, wherein the person, the person sits on the desk. So for example, if you look at a big hospital out here, right, in case of a big hospital out here, in case of big hospitals, you will see a lot of counters, the billing counter, then the reception counter and so on. So here the counters are there, because in these counters actually financial transaction happens. So if you put down the counter out there and we know at what time, the activities are done, we can track down, if there is any financial transaction, if you want to track down, we can track, right? So that's why, there's an option of selecting a counter out here. Now please note, at this moment I'm logged in as admin, that's why I can go and do everything out here. But Danphe has a full-blown security system out there, which has roles, which has profiles and so on, right? For now I'm having access to everything. So I'll say, okay, I'm on some counter called as the OPD counter, must be, I can just say, right? And over here I will go ahead and book an appointment, right? So book an appointment. So I'll just say here Niv, and so I'll just say, let me put my name out here, Shiv, and I will say Hari, and I will say Lister, right? And I'm a male, 55 years, whatever is the reason, right? Contact number, yes, you need a contact number out there, right? Remember, all of these validations are flexible, right? It can be changed. Now about the appointment time, the appointment time over here, for example, at this moment, so for instance, at this moment it is like 3 out here, right? So we can't put an appointment at 3. Okay, so if you try to now go and book an appointment, it will actually fail, because this 3 is like too near, right? So you need to have an appointment time which is a little bit ahead, right? So let's make it 5 out here, right? And I'll say add an appointment. I don't know which doctor that person wants to visit. I have no idea which department he wants to visit, so I'll just leave it empty, and that's the appointment, right? So if I now go to the appointment booking list, I can see that there is someone called as Mr. Shiv Hari Bist. That is his phone number, and he has booked an appointment, right? Now please note that this person has still not arrived in the hospital, right? So that's the appointment flow out here, right? Very easy. I'll just show it again, right? You will click on book appointment, you will say new patient, you will put the basic details. It's a very basic details. We are not putting here, we are not putting details, like that, what the person has issues, whom he wants to meet the doctor, right? These are all optional out here, right? So it is just the basic details, and then once you book the appointment, right, you will see the patient in the appointment booking list out here. So now that we are done with the appointment, right? So now let's say the patient has done the appointment, and after some time he comes to the hospital, right? Now please note that 99% times, I'm talking about Asia, I'm talking about India, Nepal, Bangladesh, Sri Lanka, Pakistan, right? 99% times what I've seen is that the patient directly comes to the premise, right? That's 99%, but as I've said, that I'm not aware of other countries out there. Do they really have to book an appointment and come? If it is right, please write down in the YouTube comment if you have a different flow, right? But 99% time, the person can come in premise directly as well, right? So what happens if he is in the premise, right? If he is in the premise, then what will happen is, first we'll check he has an appointment or not. If he does not have an appointment, then we have to go and fill all the basic details, and then the registration happens, right? If he has an appointment, then the data is pulled up, from the basic appointment, and then we move ahead to the registration. Okay, let us go ahead. So let's go to our screen. So at this moment, you can see this is situation number 1. I can say here, okay, Shiv Hari Bist has come to the premise, and I will say check in. Now once I say check in, you can see it is trying to create a visit. A visit means that the patient is inside the hospital. So let me go to the diagram out here. That's what the visit is, right? So visit means that the person has come to the hospital. Now it is very much possible that the person can come directly to the hospital. If that's the case, then what you will do is that you will click on manage visit, and you will say new patient, and you will write down the details out here. I repeat, if he is coming through the appointment, you will go through here, right? Okay, you will book an appointment, and then you can get him from the booking list of the appointment booking list. But he comes directly, then you can directly go and start from here. And as I've said, most of the patients directly come to the hospital, right? So but for now, I have an appointment, so I'll just do a check-in, right? And you can see he pulls up the basic details what I have. Now there are some fields which are needed out here, so I'll say religion, yes, others. Now why have we put a religion box here? Because depending on the religion, we know the food habits. At least we have a basic idea of the food habits, the basic idea of how the patient in what environment the patient is, right? So that's why the religion is out here. And remember that this religion is configurable, through the master tables, right? And we'll see that how to go and put this religion and everything, right? We'll see that later on, right? For now, just select others. I'll keep everything as it is at this moment. This software we have, we have set India as a country. That's why you can see that India is shown by default. But if you set the software as some other country, then it will show accordingly, right? Now, when the person is inside the hospital, definitely we have to he has to tell that which doctor he has to visit, right? So you can see now some extra information of visit is coming out here. So I'll say, okay, I want to attend let's say Dr. Madhav Patade, right? And he's from some department out there. Now, depending on what doctor I select, right, I get his consultation charges. Later on in the videos, I'll show how to go and put these consultation charges, right? So you can see there's a consultation charge out here, and we will go through the other details later on, right? So let's say the 50 rupees is the consultation charge, and let's assume that the patient is paying in cash, and I will say print an invoice, and there it is. Now this is very important, right? Already in this system, I have registered ShivBist as a patient, right? So let's look at the flow out there. Remember that if before registering the patient, if the patient's name and the phone number matches, then he will ask you a question like this, saying that, hey, like, ShivBist is already registered. Do you want to are you sure that you want to re-register him again, right? Or you want to check in the patient as a visit? That means if he's a new registration, he will go out here, right? Or if no, then he will make it as a visit, right? So what I'll do now is let me go through the new flow out here. So I'll just say this is Shiv Prasad, that is my full name, right? And I'll just say Bista, right? And must be I'll put some different phone number out here, just so that I don't get that box out there. I'll say print invoice, right? And I'll say confirm. Our ethnic group is mandatory. Yes, I'll just say others, right? Print invoice, confirm. So there it is. Now you can see at this moment this system is configured, for someone called as iSystem, right? But remember, over here you can always go and put your hospital name, you can always put your logo and so on, right? So there you can now go and print the receipt of the consultation charges which has been paid by the patient, and the patient can proceed to the doctor. Okay. At the left hand side we have something called as a sticker. We'll talk about this later on. This is not compulsory for many of the hospitals out here. For now, just keep a focus on that. We'll talk about how to enable and disable this, and we'll talk about what exactly this is, right? But now here I can go and I can print the receipt, and the patient then moves towards the doctor to do clinical. So look at this, what we have covered till now. We created an appointment. After the appointment, we registered the patient, right? We told which doctor is going to visit. We printed the billing fees, the consultation fees we have printed, right? This is compulsory. If he's not paying the consultation fees, he can't meet the doctor. And now we are going towards the clinical flow. So he has done with the appointment, right? The registration is done, and there is a visit created. The doctor fees is paid. Now the patient is in the doctor's cabin, and the doctor is attending the patient, right? Let's go back again to the website, right? So there it is. So here it is. You can see this clinical section out here. So he clicks on clinical, and the doctor sees that this is the current patient, Shiv Prasad Hari Bista, right? And the doctor wants to attend him, right? Now when the doctor attends, right, he can do the following things out here, right? So what he can do, one is that he can give him medications, he can tell him to do a lab, he can tell him to do a radiology, he can tell him to do any other procedures, and he will write notes out here, isn't it? Right? So let us do like this. Let us go ahead and fill some medications. Let us go ahead and fill some lab. Let us do some radiology, and let us write some notes out here, right? So I'm going to go here and say, you can see this icon out here, action, and we will go out here, right? And there is a screen out here. So now I'm not a doctor, frankly, right? So I'll just put down here. So there's some past medical conditions you have some immunization. So you can see a lot of notes out here. Now remember, all of these notes are very configurable. They are very configurable out here, right? So doctor will put some notes out here. Doctor can go and create his own notes, own section he wishes, right? So some notes on medical conditions he will put out here, right, and so on, and he will save it, right? Second, he can also go and put the surgical history, you can put the family history and many other things out here, right? The next very important thing, is the orders, right? So he will now go ahead and place the orders. Remember, the orders can be of these different types, right? You can see that there is here something called as request medication. So when we say medication, means I'm talking about the pills, I'm talking about any kind of doses he has to take, right? So I'll just request a medication out here. I'll say, okay, please go and provide him some of these medicines out here. He'll be taking from mouth 3 times in a day before the meals, right? Duration 2 days, and add. And must be, I'll provide him some other medications. I don't know if it is Dolo is there. Okay, Dolo is there, right? And something strength, and then again must be from the mouth, frequency 3 times in a day and before meals. I'm sorry if I'm putting some wrong medication out here. I'm a technical person, so doctors, please excuse me if I'm putting some wrong things out here, right? Add here and add, and that's done. So you can see now, again, look at the flow out there. He has put this medications out here, right? Second is, he can go and order some labs out here. That's where we have the investigation orders. So you can do a lab, he can order an imaging, a scan, right, a radiology, and so on. So I'll just go to the labs out here. So I'll just say request, yes, I want to go and do a lab. So let's say I want to go and do let me see if I have some I can take something. So let's say I'm taking some lab out here like this, blood group, I don't know what it is, right? Who is the performer? I'll just say performer, and performer can be someone else, right? So this will go to the lab department. I really don't know what this test is, guys, but this is some test out here. Okay, I'll say yes, request this test. I can add some more test out here if I want, right? So this is one test. I'll just say request this test, right? And confirm, you want to select the test? Yes. So there is one test which I've ordered, right? Second, I can also order some imaging scans out here. So I can again say, okay, I want to do some scans out here, like let's say a fast scan, right? So this is a scan out here. I'll say again, say request, right? And it's confirmed, right? So if you see now at this moment, you can see that this doctor has done multiple things out here, right? One is he has told, what kind of orders are there, right, which he has to take, right? Second, he has also put the lab and the radiology, right? Great. Okay, and then what, right? So let's see the next flow out here. So now remember that again, like there are many things out here. He can put more notes out here, the subjective, the objective notes, the assessment, and remember, as I've said, these all things are configurable. These all things are configurable out here, right? So at this moment, I'll not go in the notes. As I told you, I'm not a doctor, right? So really, if I put some data out here, it won't make sense to you, right? But I hope that I've clarified that the doctor can do all of these things out here, right? Now let's move ahead towards lab and radiology. So now, if you go to the laboratory, right? If you go to the laboratory out here, right, you can see that Shiv Prasad Hari Singh Biste is out here. Also on the radiology, I can see two Shiv Prasad Hari Singh Biste because I feel that I have made double entry out here. We should be looking into this one. You can see there's a hospital number 8504. So that's the entry we should be looking at, right? So this one, okay. This one, I think I made an entry and I made some mistake. So I think we can excuse that right now. Whatever it is, right? For that patient, whoever wants to do the lab and the radiology, one of the very important things is that he has to go ahead and do the billing. If he does not do the billing, then he won't be able to get the reports of the lab and the radiology. They can go ahead, they can do the test, but they won't get the results on the hand, right? Let me know in your hospital, how does it work? Do they have to first make the payment and then go, or how does it work, right? Remember here, at this moment I am talking about only outpatient, right? At this moment the flow where I am trying to focus is over here on the outpatient. In case of an inpatient, I understand that you will have credit, right? You will have insurances, so we'll look into that later on, right? So here it is. You can see now this is the laboratory out here, and I see this is Shivprasad Hari Singh Bister, right? I'll say view details, and this is what the test we have to do, right? I'll say okay, go ahead, collect the samples and print this thing out there, right? Print the sticker out there and then stick it right on the test what we have done, right? Add the result. Now in case of Danphe, we do have a lot of automation, so you can go ahead and you can do machine integration out here. These are the supported LIS machines. So what you can do is you can go to the GitHub out there. I have put down the LIS machines, which are supported out here. So these are all the LIS machines which can be integrated with the Danphe application, right? So at this moment I don't have the integration, so I'm going to go and do it manually. So I'll say add the result, I'll just say save the result, right? And there you have the lab out here. You can the lab person can go and put comments as per the results, right? And he can add signatures out here saying that who are the person who are authorized for this results out here, and I'll say save signature, and then afterwards we can go ahead and print it. So you can see here it says that, oh, the bill is not paid. That's good. So you can see here, very good. I'm sorry, a cough here. So you can see here that bill is not paid. Now that's why, because the person has not paid the bill. So let's go to billing out here. Let's search for Shivprasad. Remember, we are talking about 504. Okay, we are talking about 504 out here. And so you can see there are two provisional items out here which they have to pay, right? So provisional means this bill is still not paid, right? So let us go ahead and do the provisional clearance. So we'll say here this guy 504 will go ahead and he will make the payment of the bill, and there the bill is paid. And now if you go and if you search for the patient out here, you should see that everything is now paid, right? You can also go and see a detailed view. So here you can see there were consultation charges, and then there were lab charges and scan charges, right? Now that the bill is printed, he will go back and say, hey, like I've paid the bill, right? Okay, there I can see now the bill has been paid. I'll say print, go ahead, take your results out here, and the print is done, right? So once the print is done, it will just show here print done, right? Same thing for radiology again. So for radiology again, now remember again, here also we have the PACS integration, right? The scan integration, but at this moment we don't have it. So we'll say yes. We'll just select the film type. We'll say the scan is done and done, right? And once the scan is done, you can go ahead, you can add reports for that scan. So let's say for this, he will go ahead, he will add a report. Now there are different templates out here. Please note at this moment, you can see there are report templates out here which you can go ahead and you can load it. At this moment there's a default template, but there are lots of ready-made template. So we'll go here, he will select the signature, he will write the report, right? He will take up the template, he will write the report, whoever has performed this, right? And he will say submit and print. Okay, and that way it will go ahead, it will submit this report, right, and print it. Okay, and these are the list of reports out here. So if you want to go ahead and reprint it, you can do the same. Okay, so that completes the lab, that completes the radiology, right? Now remember, we had also ordered, so very quickly let's go to the diagram. So you can see here, look at the billing, he did the execution, right? The billing was paid, right? Now also there was another part which is the pharmacy, right? So we also gave him some medication. So now that's where the pharmacy person logs in, or I'll say the dispensary person logs in, right? So I'll say yes, this is the main dispensary, this is the counter, right? So let's go ahead and search for Shivprasad Bister, right, out there, 504, right? So he says, yeah, this is the patient, and let's Let's see that what he wants, right? So he says that he wants these 2 tablets. Do you have it? Yes, I have it here. I have the tablets. At this moment, there are no tablets actually. So what I'm going to do is I'm going to go and say, I'll just update the quantity saying, yes, we do have the tablets, right? When you have the quantity, then it won't show you anything out here. But now that you don't have the quantity, I'm going to go and say, yes, we'll update this prescribed limit out here. We'll proceed to sales, and that's what the sales out here. Print the invoice, and this is the slip, which is coming from the pharmacy, right? So if you go back on the diagram, so the pharmacy will have a separate billing. Now, many of the people also pay billing internally as well. So sometimes, in the pharmacy, they will go, in the dispensary, they will go and say, okay, here are the lists, right? And they will go and pay in the centralized billing. So it depends, you want to go and pay from here, or you want to go and pay from here, right? At this moment, I've shown this flow out here. And finally, the most important one, which we will not do in this demo, is that it will go ahead, all these transactions. So we made a transaction here, which is of the consultation fees. We made a transaction here of the lab and the radiology. We made a transaction here of the medication. Everything has to go to accounting. That is the most important part, right? And that accounting system should be able to export to another software like Tally or some other accounting software which is used, right? And then depending on the results, depending on this, he can exit the same day by taking all the printouts, or else he gets admitted, or else the patient gets admitted, right? So this is Shuprasad Bista. If everything is not good, right, what we can do is we can go ahead and we can admit the patient. So there it is. If you say admit, from here the inpatient flow starts. We'll talk about this flow later on, right? But here I just wanted to complete the basic flow. So remember, we did the appointment, we then did the registration, we created a visit, we paid the doctor fees. After that, all these things spawned up, right? Lab, radiology, we did the lab, we did the radiology, we wrote some notes, we did the medication, the patient paid in the pharmacy, right? So this is the basic flow. Let me know if there are any questions out there in the basic flow. Now, very important here is that I want you guys to go and look at this flow. So this flow I am putting down in the description section. Also, I'm putting it down in the comment section. Go through the flow and try to map with your hospital, right? And if you think that okay, in my hospital I have the flow is like this, I would suggest everyone to please put down in the comments, so that as Danphe, we are aware that these kind of flows are also available, right? So that is all about the basic flow. Guys, now before we move to the next section, right, I would like to get some feedback from you. You just saw the basic flow, right? Now, definitely, this software is installed in India, Nepal, Bangladesh, Sri Lanka, and in a lot of, mostly into Asian countries out there, right? We also have some of the systems live in Kenya and other places as well. I want to get a feedback from you. How does your hospital system work, right? Do they pay first the bill, then they go to the doctor, or do they directly go to the doctor, right? How does it work, right? Please put down in the chat below. That will help me to visualize. That will help us to visualize also that, how can we include the community flows into our software, right? So that is my request. Please go ahead and put down how does your hospital system flow works, and what do you look into an HIMS or a EMR and a EHR. Please do put the feedback down. So, okay, so that brings us to the end of almost of 1 hour, right? I hope that you liked this video. This was now just chapter 1 with 6 lessons. As I've told, right, if you hit the like button down below, if I exceed 100 likes, I'll be coming out with chapter 2. I will record more advanced flows, in-depth flows. Remember, Danphe system is currently working in more than 100 hospitals. 100 hospitals. So I know that what flow I have talked here is nothing, right? It's a gold mine out there inside Danphe, right? Every time we launch in a new hospital, there is something we add, right? So if you want me to record more of these videos, right, please hit a like button. And second, remember, I'm giving a gift out there. If you go ahead and if you share this video on your LinkedIn, and tag me, please do tag me out there, right? Please do tag Danphe, our LinkedIn page out there. I will add you to the Telegram channel where we keep releasing new features, and you will be aware of what new features are getting released. So thank you very much, and Happy installing this HIMS, EMR, EHR. Thank you.